Welcome to the Explore Global Health podcast. I'm Dr. Rob Murphy, Executive Director of the Havey Institute for Global Health here at Northwestern University Feinberg School of Medicine. My guest today, Tulio de Oliveira, is a bioinformatics specialist and infectious disease expert who works in genomic surveillance. He has helped inform and shape the global response to the COVID-19 pandemic and is well known internationally. His team in South Africa was the first to identify major variants of concern, such as Beta and Omicron. This work helped alert the world to emerging threats in real time and landed him in Time magazine's list of the 100 most influential people in 2022. The journal Nature also named him as one of 10 researchers who shaped science in 2021. Tulio is the director of the Center for Epidemic Response and Innovation at Stellenbosch University in South Africa, and he is also collaborating with members of our institute, the Havey Institute for Global Health, through the Stellenbosch University and Northwestern University Global Health Knowledge Hub. Today, we're going to talk to Tulio about his incredible career journey and why he's working to ensure that genomic science in Africa doesn't just contribute to the field of global health, but helps lead it. Tulio, welcome to the podcast.
Thanks so much, Rob, for inviting me to your podcast. It's an honor to be here.
Let's start at the beginning. You were born in Brazil and into a family that was influenced by activism and social justice. Can you tell us about your childhood and what you remember most about those early years in Brazil that shaped the way you see the world today?
What shaped me as a young person? As you mentioned, I was born in Brazil. I was born in the capital, Brasilia. It was a new city, recently constructed. And then as a child, I moved quite a lot. My father and my mother, they are architects and they design public transport, very large public transport systems. And I live in the northeast of Brazil, in the north. And then I moved to the deep south, which Brazil is very similar. The United States of America is a country of continental proportion, quite different areas. But one thing that really shaped me a lot, my childhood in Brazil, was living in the deep south of Brazil. It is next to Argentina and Uruguay. To be honest, they call ourselves the Gaúchos. This means the cowboys, before they called the Brazilians. And it's a very interesting place with very large Italian, German immigration and quite a very social active place. That's where it started the World Social Forum. And that was quite exciting to be in a city that was very diverse, thinking a lot about social issues. And the other thing that shaped me a lot was my love for nature. My family always had a holiday house in the state of Rio de Janeiro, in the north of Rio, where it has some of the most beautiful coastlines in Brazil, full of islands. And so I spent large time of my life, my childhood and young adult, under the sea, close to nature. And that's where it grew a lot, my love for biological science.
I didn't realize you were from Brasilia originally. It was one of those brand new cities just built in the middle of the Amazon, really. It must have been very exciting growing up there.
Yes, as a child was excited, and newly designed city, very much what is Washington, D.C. to the United States,
exactly.
Kind of central capital, and that's where a lot of the policies are run from the country.
You had an interest in computers and coding very early on. When did you first start coding, and what was it about computers that hooked you long before bioinformatics was a defined field?
When I was a child, around when I was 11 or 12 years old, I was classified as in Brazil, they call a gifted child. And as part of that, I joined a program for gifted children of our main university in Brazil, Federal University of Rio Grande do Sul, which I went to study there. And that was quite exciting. So that time was in the early 90s, computers were just become mainstream. And then as part of that, I got a lot of classes on programming. Some old language, BASIC and Prolog, was considered to be one of the first artificial intelligence languages being developed. Got introduced to Unix and Linux when I was still growing. And that was quite exciting. And that's what that kind of programming base that when I was early at the university at URGS, the Federal University of Rio Grande do Sul, which is one of the top 3 universities in Brazil, then that I joined what was an nascent field, bioinformatics. I was working in the biotechnology department as a research assistant, still doing my graduation. And that's when I tried to join the true passion for biological science and from computer science and join a new area that was being formed that was named bioinformatics, using informatics to analysis of biological data, especially DNA and protein sequencing.
As your interest in computers and science was growing, your life also took a very important turn when you moved to South Africa in 1997. What led you to move to South Africa, and what did arriving there open up for you, both personally and scientifically?
Moving to South Africa in 1997 was an unbelievable experience. Why that? You have to remember is that South Africa was through the change. Mandela was still the president, Nelson Mandela. And why we moved to South Africa is because my mother went to Mozambique. She lived there as a child. We are from Portuguese family also. And she went to Mozambique, which also have just become a new independent country. Not independent, they become independent in the 70s, but that was in the late 90s that a civil war finished in Mozambique because that was funded by the apartheid. So as the apartheid fell, the civil war fell in Mozambique, and my mother went to Mozambique to lead many of the reconstruction programs of Mozambique that were part of the United Nations, the UN. And then my sisters and I, we stay in South Africa, in Durban, beautiful city by the coast, in the East Coast, because the university in South Africa were much more developed than Mozambique and was still close enough that you could drive for a long weekend to Mozambique. So it was a great time to be in South Africa when the country is transforming, and many people had very doom predictions about South Africa, but it was a magic time. It was a time that South Africa transformed from one of the most brutal discriminatory regimens in the world to an open society without any fighting or destruction of the country. The opposite, interest and love in the air at that time.
Yeah, I remember the Durban AIDS conference in 2000 was really a turning point in my career. And it was incredible. I mean, people were trying to scare us. Oh, it's so unsafe. You know, everyone was all nervous about going. I remember getting down there, and it was a beautiful city. There was a modern conference center. It was an incredible experience being in South Africa in the year 2000. By the way, did your mother do her architecture training in Brazil or in Mozambique or South Africa or where?
In Brazil. She went in Brazil kind of in exile. She completed her university, had 3 children, and decided to go back to help Africa. And I also remember the Durban conference was one of my first conference. I had some presentations there, and it was amazing to see both the international scientific community and the South African come together also to fight another scourge that was HIV/AIDS. And that was also a pivotal moment on the HIV treatment, not only in South Africa, but in the whole world.
Absolutely. You completed your undergraduate education and your PhD at the University of KwaZulu-Natal in South Africa, and you began working in HIV genomics. How did this work and proximity to people living with HIV and clinicians impact your desire to work in epidemic scale infectious disease research?
When I was in Durban, I completed my degrees at what was called the Nelson Mandela School of Medicine, which is part of the University of Natal, now University of KwaZulu-Natal. And that was, again, very incredible medical school. Why that? Just to get an example, as Nelson Mandela became the president, he gave the name to the School of Medicine because it was the only school of medicine in South Africa that would cater for non-whites. And that was during the whole apartheid. It was a university that not only was very active politically, but also took very serious the scourge of HIV and AIDS because that would affect most African population. And we have some key scientists there, some of my mentors that are now my friends, Lim Karim, Jerry Kovaria.
Yes.
They were the 2 chairs of the AIDS conference in Durban. And that was really like not learning only from the locals, but learning from the best, because these were people that were really in the epicenter of the HIV pandemic. That's the ones that were developing a lot of the tools to fight that, doing the trials of the first antiretroviral therapies, prevention, interventions, and so on. So it was very motivating to be like landing in South Africa, which many people would not expect to be scientifically advanced, but end up in the kind of center of scientific excellence, medical research, especially on HIV and AIDS. And at the same time, seeing the impact on the population, which really motivate us to grow large programs of HIV research, treatment, and prevention.
Next, you went to the University of Oxford in the United Kingdom for your postdoc fellowship. And that experience was also extremely impactful for you and really revealed the real world power of genomics. Can you tell us a little bit about that?
When I was at the Nelson Mandela School of Medicine, as I was doing my PhD, I also started working with a very large group from the Wellcome Trust, what called the Wellcome Trust Africa Center for Population Research, and that had very strong links to universities in the United Kingdom. The Wellcome, it is the biggest philanthropic funder of medical research in the UK, and that then generated a lot of links with British research groups. In addition to that, by that time, I had published a bioinformatics software application that got very highly used. And then I started collaborating with international researchers, most Europeans and people from Oxford University, when then I applied for one of these very competitive fellowships. It's called the European Commission Marie Curie. And then I was selected in that fellowship. And then I moved to the United Kingdom to live in Oxford, one of the top universities in the world, where I also ended up in a phenomenal group that was the evolutionary biology group, probably one of the best groups that ever existed in the world. And there we work a lot on advancing not only software applications and bioinformatic tools, but also applying them for analysis of genetic data of multiple epidemics.
While you were at Oxford, you and your colleagues sequenced HIV and hepatitis C virus in a case of the foreign medical workers who were accused of deliberately infecting children at a Libyan hospital. Could you tell us a little bit about that story? That was pretty exciting.
That was exciting and a scary story. So when I was in South Africa and while I was in the UK, commonly there was a common link. Every year would go to Italy, to Rome, to what you call the National Institute of Health in Rome. That's called the Istituto Superiore de Sanità, to teach about bioinformatics. And then what's happened? There was a very large outbreak in Libya a few years before, and that infected 438 children in a hospital. The parents, the mother and the fathers, were HIV negative in Benghazi, Libya, which is also Islamic town. If for people that understand the impact of Islamic culture on HIV transmission, some of the Islamic countries have the lowest rate of HIV in the world, so it was very shocking. And as part of that, the children went for treatment to receive like a state-of-the-art treatment, both in Rome and also in Geneva. And that's where some colleagues from Geneva, University of Geneva, and the National Institute of Health in Italy have sequencing the virus, both HIV and hepatitis C. And then so they asked for help to analyze the data, which of course we did help. The only caveat that when they really asked for help was 6 weeks until 7 medical personnel that were accused of transmitting HIV to children to be executed in Libya. So we had 7 weeks to go and kind of try to do analysis of the data to see if that was really a problem of deliberate transmission or not. I went to Rome because I said we need access to all the data. We start the analysis, and then we could see that the data was quite clear as we apply new technologies called molecular clock. We can time when strains emerge, very useful during the COVID pandemic. And then we could see that it was quite clear that this was not a unique event. That's what the medical personnel have been accused, but a long last nosocomial. Nosocomial is a technical word for hospital-transmitted infection. So we went back, we finalized all the results analysis in 3 weeks, working like 20 hours a day, accessing supercomputer, and then we submit for publication in one of the top scientific magazines, Nature, which then, because it was a very controversial case, assigned 9 reviewers to the paper, half of them closed and half of them open, and then the results were quite clear. That was not a deliberate act, and that a very sad story, 438 children infected, but that the medical staff was not responsible for that. And then we start working to use that as evidence evidence that was not a deliberate transmission act.
That was an incredible story. Just incredible. Congratulations. A huge achievement, and to do it so quickly.
And the best achievement was not only the science, because the science was very good, but then we work with the science activists. We work a lot with the Nobel College. We got 119 Nobel Prize winners to review the data and agree with the data. We work with the UK Royal Society, which also trust the data. And then we work with that time what was the Director General of the United Nations, Kofi Annan, to then talk with the president of Libya, that time was Gaddafi. And that high-level scientific work together with politics end up with a very positive results. The medical staff were not executed, and they were transferred to Bulgaria, where many of them were from, and they were freed on arrival.
Wow, absolutely wild story. Let's shift gears a little bit. A lot of young professors in your shoes would have stayed or moved to the global north, but in 2009, you went back to Africa to establish the next step of your career. Tell me about your decision to go back to South Africa in your work as director of what was then the Wellcome Trust Africa Center's genomics program in the rural village of Samkahele.
Yes, now I go back to South Africa not only for research, which very advanced, but also because love. I marry a South African in the process.
I think that
And
has
she went
something to do with it.
And she went to return for South Africa. She got offered a very nice fellowship at the University of Cape Town, which completed her PhD. So she was with me in Oxford. She came with me to the UK, and then I follow her back, and then end up after that going back to the same organization that I was before my PhD, but now to lead the genomics program, which was the Wellcome Africa Center.
In 2016, you and your family, your wife and young children, you moved to Durban, the site of the University of KwaZulu-Natal's medical campus, and soon launched the KwaZulu-Natal Research Innovation and Sequencing Platform known as CRISP with a K, KRISP. What was the vision behind this move?
So I spent 7 years back at the Wellcome Africa Center, and then I decided it was time to found a new institute, and an institute that would be then fully rooted in South Africa. I still work a lot with the British researchers. I still have multiple grants with the Wellcome and Oxford, but we wanted to now create new independent institute. And that's what I did. I funded what was CRISP, the KwaZulu-Natal Research Institute for Sequencing Platform, which was in the Nelson Mandela School of Medicine, and that was to then create an independent research institute that would then focus a lot on genomics and the interchange between genomics and clinical infection, and then to fight epidemics. And then again, for your young scientists, it's always a big decision. Should I stay in a very well-resourced group, or should I start funding my own institute? So with hindsight, is like it was a fine line between courage and stupidity. How you live. One of the extremely well-funded research to found yours, but I had courage, and CRISP was a very successful institute. So in the end, that was a right decision. But with the hindsight, life is perfect.
But in 2021, at the height of the COVID pandemic, you took a position at Stellenbosch University, leading the Center for Epidemic Response and Innovation. So what's the vision of this center, and basically, how did you end up in Stellenbosch, where you are today?
We are going through the pandemic. Our research group at CRISP had a big leadership role in South Africa. We led the whole national genomics program. We helped the Africa CDC and the WHO Afro to lead the African genomics program. And we discovered multiple variant beta. We helped the UK to identify the alpha. We worked together we identified the Omicron. And at that time, I was headhunted by many of the top research groups in the world. And then was again going back to my wife and my children. Would you like to move to Seattle, or back to England, or maybe to Scandinavia, or Stellenbosch? And then they were quite clear. Stellenbosch. And why is Stellenbosch? It is still in South Africa, so it's in this very phenomenal scientific ecosystem, but is extremely well-run, extremely well-resourced university in one of the most beautiful scenic places in the world. So by creating a new institute here, not only we had cutting-edge, state-of-the-art facilities, but also a very desirable place to live. And that was crucial to me to move here, because as part of that, in the last 4 years since Genomics, I founded CERI, the Center for Epidemic Research Innovation. Now we are a team of 150 scientists under my directorship. And more important, we have brought back some of the top scientists in South Africa that were overseas, and many of the top international scientists moving from the global north to the south, just not only to make the difference, but also to enjoy the absolute beautiful area we are in, would be like the Napa Valley of the United States. We are in this beautiful wine region, in addition to 30 kilometers from Cape Town, which has some of the most beautiful scenic mountains and sea in the world.
Stellenbosch University is a long partner with Northwestern, and that's why we have this global innovation hub there. So we've really enjoyed working there. I've actually visited your lab. I think you were in Durban at the time, but it's a very, very impressive facility, what you've put together there. It's absolutely amazing. Congratulations on that.
Let's mention that we are as excited as work with Northwestern University as you are with Stellenbosch. We are also extremely impressed, not only with your beautiful campus, but the quality of the science there. And I think that we are a great match. Yeah, so thank you for that.
I want to talk about training young scientists and other scientists. And it was really encouraging to hear that you've been able to attract back South African scientists who have left the country and you brought them back. Can you talk to me about what you think is important about training young scientists? And, of course, publishing papers and getting grants is part of it, but you have to train the next generation. What is your feeling about that?
In relationship to capacity building, that's something that is a big passion. We thought that was our moral duty. During the pandemic, we did raise hundreds and hundreds of millions of dollars. We, in addition to have a scientific team, we have a very senior and very professional grants management and financial management team. We raised a lot of funding. We built phenomenal infrastructure, but then we thought that would be our moral duty to give back to the young scientists, and especially of other African countries that only tend to experience that kind of very advanced state-of-the-art facilities in the Northern Hemisphere. Then we start a very large fellowship program. I work with a basket of funders, some very great funders like the Rockefeller Foundation, the World Bank, a company not far from you in Chicago, Abbott Diagnostics, funding to create this fellowship program. And in the end, it's one of the things that fill our heart. We are just to hit 1,000 fellows that have been hosted in our centers. And many of them, hundreds of them, don't come for weeks, they come for years, and they end up with very advanced degree. And one of my proud moments is that when I was listed in the Time 100 most influential person, I was listed together with one of my PhD students, ex-PhD student. And that's so nice to see the kind of this large investment and young scientists start making a difference. So we host fellows from 50 African countries and for another 38 global South countries. And now we have a big program of exchange with a lot of top scientists from the US, from Europe, coming here to also help to teach the fellowship.
That's really incredible what you've done. One final question, Tulio, and I'll let you go. What advice do you have for young people today, wherever they are around the world, who are just now embarking or wanting to embark on a career in global health?
As scientists, we have to focus on the task in front of us. It's a very difficult task, especially now with very large amount of misinformation and destruction of public health and global health infrastructure. So more than ever, I think my biggest suggestion for young scientists is that, yes, we need you. And not only we need you, the world needs you, because more than ever, it's time to the scientists to advance science that save lives, and not only save lives, because that also improve livelihoods. At the moment, we are in a very difficult time in the world. I can see a lot what's unfortunately happened in the United States of America with great polarity. And what we need is that all the global disturbance will help to fuel infectious diseases. And in the end, infectious disease affect everyone. They don't matter if you are from the center, the left, the right. It will affect you. It
Everyone.
will affect your parents. It affect your children. So more than ever, the scientists have to really focus on the big job. The same way as a medical doctor, when graduate, they have to do a promise to help to save lives. I think scientists now have to do. So more than ever is an important task ahead of us. And we needed the brightest and the most motivated people in the world.
Tulio, you're a remarkable person. It's a pleasure to get to talk to you today and learn really all about your pathway in global health. And I appreciate you taking your valuable time and helping us with this podcast.
And again, thank you for the invitation. It's a great pleasure to partner, to work with Northern Western University, and also to talk to you today. Thank you. Thank you very much.
Follow us on Apple Podcasts or wherever you listen to podcasts to hear the latest episodes and join our community that is dedicated to making a lasting positive impact on global health.